Hello, class. My name is Jessica Fifi, and along with my partner, Marie, we'll be presenting to you our group project, which is on adjustment disorders. The case seen below is of a patient diagnosed with adjustment disorders. James is a 13-year-old African-American male who is recovering from an experience of divorced parents. The family has been good together for the past 10 years until the beginning of COVID-19, when James' father lost his job due to layoffs. James, as the firstborn of the family, was the father's favorites beside his sister. Over the weekends, James and his father were always out camping or swimming if dad was not busy with other duties. At the beginning of the pandemic, James' father got laid off and started drinking to overcome stress. Mom was equally trying but grew tired of dad's behavior and inability to keep up with family demands. At the beginning of the previous year, Mom filed for a divorce that was granted around July. With Mom gaining full custody of the children, James' father, on the other hand, traveled to a different state to start a new life. As narrated by the mother, James hasn't stopped isolating himself since his father left. He has been rebellious and sometimes does not even go to school. He always wants to be alone and even rejected his sister. The mother is worried because James has recently hinted about killing himself. Adjustment disorders are mental health disturbances, also referred to as stress response syndrome, that results from an identifiable stressor. According to the DSM-5 criteria, the maladaptive behavioral response to stress should not be related to a known mental disorder. Individuals can be exposed to several stressful conditions that can either produce post-traumatic stress disorder or adjustment disorder. Adjustment disorders particularly relate to how individuals react or adjust to events associated with life changes. The life changes could be the death of a loved one, divorce of parents, as exemplified in the case study, family moving to a different location, losing a pet, or adjusting to chronic illness. In most cases, individuals acclimatize or adjust well to such stressful situations within a few months. Those with adjustment disorders fail to adjust properly to these changes and experience significant distress than will be normally expected. The response to life changes negatively affects their lives to the extent of anxiety, depression, and negative effect on social functioning. In this case study, for instance, James had a challenge in adjusting to a life without his father to the extent of wanting to commit suicide. Therefore, adjustment disorders can generally be defined as stressful, anxious, or depressive reactions to life changes that, while can be mild, impairs one's social life. Adjustment disorders are common among children and adolescents. However, the disorders can also present among adults. The prevalence of adjustment disorders is estimated at 2.9% in some populations. In the United States, the prevalence is estimated between 8% and 11%. The incidence is estimated between 5% and 20%. Noteworthy, the prevalence and incidence of adjustment disorders remain challenging to correctly estimate. Most of the diagnoses are underreported, and when reported, diagnosis can remain challenging. Human beings constantly adapt and adjust to life changes. After bereavement, for instance, one gets used to life without a loved one. Under these circumstances, one easily maintains physiology and psychological equilibrium. However, for some individuals, and under certain circumstances, adjustment to life changes become challenging and physiological and psychological equilibrium is not maintained. All pertinent changes related to the failed attainment of equilibrium are associated with the brain, being the organ responsible for stress and adjustment. Generally, the hypothalamic pituitary adrenal HPA axis is of interest in response to stress. Adjustment disorders result from stress-induced hyperfunction in the HPA, and a reduction in the activity of the axis abates the symptoms. The role of organs, including the hippocampus, amygdala, and prefrontal cortex that regulate the HPA, cannot be under-acknowledged. In events preceding adjustment disorders and PTSD-like disorders, There is a loss of spines in the medial amygdala that tends to hyperactivate the HPA axis. Within the prefrontal cortex, the dendrites shrink and debranch, leading to cognitive rigidity and loss of resilience to stress. This potentially explains why individuals cannot establish psychological and physiological equilibrium after stress. Neurotransmitters, hormonal, enzymatic, and genetic changes also play key roles in the pathobiology of adjustment disorders. In patients with adjustment disorders, especially those who contemplate suicide, neurotransmitters have been studied to be dysregulated. While studies are limited in this area, an early study by Tripodikis revealed monoamine oxidase MAO activity to be low while MHPG and cortisol are significantly high. The elevated MHPG and cortisol remain key as these are neuromodulators of stress. The most widely genetic alteration in adjustment disorders is epigenetic modifications. As documented by McGuinn, stress caused changes such as histone modifications and DNA methylation, resulting in dysregulation of genes related to memory and resilience. Epigenetic modification of FOSB gene, for instance, has been associated with increased protein expression and depressive behavior. The genetics of adjustment disorders is, however, under active research. With an altered HPA axis and resilience to stressful life changes, patients can present a range of adjustment disorder symptoms. These symptoms can further be used to classify the disorders into types. Patients can present with excessive anxiety and depression. To this end, patients can be classified to have adjustment disorder with depressed mood or stress mood. Adjustment disorders with depressed mood present with tearfulness and hopelessness alongside depressive mood. Adjustment disorder with anxiety presents with nervousness, jitteriness, worry, and fear of separation. Some patients can present with all of the above symptoms, hence termed to have adjustment disorder with depression and anxiety. Other types include adjustment disorder with mixed disturbance of emotions and conduct and disorder that is unspecified. Now I'm going to pass it along to my partner Marie, who will continue with the rest of the presentation.
Hi, my name is Marie Joseph, and I'm going to be talking about the clinical features and also recommendation and treatment for adjustment disorder. As we just saw, Jim's stressful life situation has caused him to suffer from depressive thoughts, withdraw from social environment that include his family and friends, and also rebel against his parents. James is definitely suffering from adjustment disorder, which has caused him to have physical symptoms such as losing weight, becoming jittery, and suffering nervous system issues such as palpitation and body aches. Psychologically, Jim also having suicidal thoughts, depressive mood, loss of appetite, and anxiety. These are all symptoms commonly found in those suffering from adjustment disorder. Now, we are going to talk about treatment or recommendation for adjustment disorder. There are many forms of treatment used to relieve symptoms of adjustment disorder. The type of treatment is dependent on the age of the patient and the extent of the symptoms. These treatments include psychotherapy, family therapy, and medication management. These different forms of therapy can help patients learn how to cope with stressors and also give them coping mechanism that could help them manage their symptoms, especially stress when dealing with adjustment disorder. Natural remedies to treat symptoms of adjustment disorder include physical exercise, healthy diet, and spiritual remedies such as praying and meditation. These natural remedies can help relieve symptoms of adjustment disorder and are useful when taking a holistic approach to medicine. In conclusion, using this form of therapy can help James recover from adjustment disorder and create a healthy coping mechanism for future life stressors. Thank you.